Today we will be inserting and maintaining a nasogastric tube. First, you will want to check your physician's orders for insertion, identifying patient using 2 patient identifiers, explaining your procedure to the patient and instructing patient the need for the nasogastric tube. Discuss any discomfort and interventions that may decrease discomfort. Next, we will perform hand hygiene and don non-sterile gloves. We will assess for the best nostril before you begin, doing this by occluding one side and asking the patient to sniff. Ask the patient if they have any previous injuries or history of a deviated septum. After we have assessed nostril patency, we will begin to gather our supplies at the overbed table, assisting the patient into high Fowler's position or a head of bed 45-degree angle, raising the bed to a comfortable working position. After positioning the patient, we will measure the distance to insert the tube by placing the tip of the tube to the tip of the patient's nose and extending the tube to the tip of the earlobe, and lastly, the tip of the xiphoid process, marking the tube to indicate the length in centimeters. Next, we will lubricate the tip of the tube with a water-soluble lubricant and applying topical anesthetics as ordered. After selecting the appropriate nostril, ask the patient to slightly flex their head back against the pillow, gently inserting the tube into the nostril while directing the tube upward and backward along the floor of the nose. The patient may gag while the tube reaches the pharynx. When the tube reaches the pharynx, instruct the patient to put their chin to their chest, encouraging sips of water through a straw or sucking on ice, or swallowing if the patient is not allowed fluids. If gagging persists, check the tube with a tongue blade and a flashlight. If it's curled, straighten it and attempt to advance again. Do not force the tube. Securing the tube to the nose with a piece of tape, cut a 4-inch piece of tape and split the bottom 2 inches. Place the unsplit part over the bridge of the nose, wrapping the split ends around the tube, securing it to the nose. Next, you would want to assess for placement of the tube in the stomach. You would attach a syringe with a moderate amount of air to the end of the tube, injecting the air while listening over the abdomen and hearing for a whooshing sound. You may also test by attaching a syringe and pulling back a small amount of stomach content, or obtaining a chest x-ray to confirm placement. Lastly, we will attach suction, setting up the suction regulator to the wall and connecting to the suction canister. Attaching the suction tubing to the canister, selecting an intermittent or continuous suction mode. For lab purposes, we will select a low wall suction. Remembering to document all of your findings, however long the centimeters were marked, to verify correct placement. We will also make sure that we document low wall suction and attaching the suction tubing to the NG tube port. We will also want to time and date the canister itself, documenting output. In looking at the photo provided after this video, you see the top of a suction canister, and it provides a map of how you would actually set up the suction to the regulator and how you would set up the suction to the patient. So as long as you follow this diagram, you should be successful in setting up suction for your patient.